Just had an awesome conversation with a patient who came in who was really nervous about getting adjusted in the beginning, specifically her neck, which I would say 20% of the people are. And, we kind of went through how she's getting adjusted now and where we are. So there's different tables we'll use for adjusting the neck. So this is one of them. That's called a toggle headpiece. And the headpiece will drop very gently. So we'll lay the person on their side, adjust the neck. But this girl, we actually started out with this instrument. And the instrument very gently torques and adjusts. And you hardly feel it. And we would adjust her neck with that. And it was easy. And she got results and she felt fantastic. And it was able to get her over the hump, that initial fear of having someone's hands on them, adjusting them. Where over time, it probably took her about 2 months to get completely relaxed on the table where we would be able to just get our hands on her, palpate, which means feel around and go in and adjust it. A lot of times people watch these videos on YouTube of people going in and pulling and yanking on the neck and putting towels around the head and slamming it up the table. We're not going to do any of that stuff, okay? You don't want that stuff done maybe once in a blue moon by someone who's a master at doing it. But we're not going to do that here, all right? We're very sensitive to the upper cervical region, and there's about 3 or 4 different styles. Maybe we'll make some videos on us doing the different adjustments on people. But in order to get the result, as long as it clears the graph out, the instrument we use, we'll show you that someday, to get the scan clear, as long as it works for that individual, because when we assess someone's beginning of care, we take their personality type, how nervous they are, what their energy is like, what their tone is like, what their x-rays look like, and we devise the plan specifically for them. And if people are really anxious and nervous, we'll go easy. We'll use the instrument. We'll go in light with the hands, and then we'll just kind of amp it up if we have to as we go along, if their body allows it. If not, and we can get the results by using the instrument and they're completely at ease and comfortable, we'll go very light. It's very specific. And people love it. And it opens up multiple age groups. Our oldest patient right now is 98 years old that comes in and gets adjusted. And we're using nothing but the instrument. Very gentle. And then if you saw me adjust my kids, you would say, holy cow, does that hurt? And they're like, no, my kid's been getting adjusted since they're 10 minutes old. At the hospital, they got adjusted, their first Atlas adjustment. And we'll go in there and you'll see me, we'll move it. You'll sometimes hear the bone clunk, make the noise, and it's all good. So chiropractic will design it for the patient to get the result that we need to make sure they're just not subluxated at the end of the day. And there's a lot of different techniques that we could utilize to do that.